hospital and in China, 10 years ago, we have discussed which is better, fluoroscope or ultrasound, which is better. But now in China, many doctors use the ultrasound to guidance instead of the fluoroscope. Since 2004, our team have treated more than 2,000 cases of percutaneous nephrodystomy, and all patients have performed with complete ultrasound positioning. This patient is a middle-aged male patient. We can see from the CT scan bilateral staghorn stones and severe spinal deformity, and the liver covered the kidney. So if you use the fluoroscope to guidance, it's difficult to avoid the injury of the liver or intestinal. So we use the ultrasound to guidance because the ultrasound guidance have no imaging overlap, and we can have a good sight with under the ultrasound guidance to avoid the injury. And from the CT scan, we can see this is the liver covered the kidney. From the dorsal, we can see the spinal dorsal covered the kidney. For the first session, we chose the left side for the PCNL because this side is easier to treat. For the first session, we chose the oblique supine. The puncture point we chose the anterior axillary line, and we use the laser cluster master to fragment the stone and take it out. The access was 24 French. This is the QB after the first session. For the second session, we can see from the CT scan, this is the liver, intestinal, and spinal. No space to puncture. We chose the supine position, and the puncture point was under the rib arc. So this is just the Murphy's point. We make the puncture and establish the 24 access to fragment and the take stone out. The patient recovered very well, and after the surgery, maybe 5 days later, they discharged.